Thank you. And I'm going to tell you about the European Standard for Person-Centered Care. This standard was approved by the European Committee for Standardization, CEN, last year. And it's called Patient Involvement in Healthcare, Minimum Requirements for Person-Centered Care. And I'll tell you in a few minutes how you can get access to the standard. So why a standard? Well, it's to standardize care within and between hospitals and to standardize care between countries. And for us, it's been important to define the research methodology within and between countries. Standards can be national. In Sweden, it's headed by the Swedish Standard for Institute for Standards. On a European level, it's the CEN, and in a international level, it's the ISO that coordinates these standards. So the background to this standard I'm discussing was an initiative from GPCC, the Center for Person-Centered Care at the University of Gothenburg. So after contact with the Swedish Institute for Standards, a Swedish technical committee was created, and I was chairing this committee. We sent out invitations to participate to a wide network of organizations in Sweden, in healthcare, unions, professionals, patients' interest organizations, as well as the industry. The goal was to create a European platform for person-centered care. First standard, this would be the first standard, and it would ensure the minimum requirement for patient participation in person-centered care with the possibilities for further initiatives in the field. We then contacted CEN, and a technical committee was created called the TC450 about patient involvement, and this was started in November 2016. This is a potentially controversial area because this type of work is often professionally controlled. But we wanted to influence the structures and processes for the benefit of patients and the healthcare services, to increase societal benefit and profit, but not, importantly, not to standardize or restrict the practice of medicine. Different countries have some different distances, we realized early on, and there are different views of the patient in care between countries. I want to remind you, as was discussed by Professor Ekman, what we mean is the difference between patient-centered, where care is organized around the patient, and in person-centered care, the patient becomes a partner in the care team. So that's the major difference in order to get the patient involved in the care. The CN is organized by 34 national members, and the decisions are made by voting. And there are partner organizations like the ANEC, but they have no voting. There is a weighted voting based on the country's population sizes. So countries like Germany and France have more votes compared to a small country like Sweden. And there is a consensus type of work while during the progress of the development of the standard. There were actually some countries who were more active in the development. That was Austria, Belgium, the Czech Republic, Finland, Ireland, Norway, Sweden, and Portugal. And the actively involved organization was the ETUC, the European Trade Union Confederation, and the European Consumer Voice and Standardization, ANEC. But as I said, they hadn't voting, but they could participate in the actual writing. So the standards opens with a scope, and it specifies the minimum requirements enabling patient involvement in healthcare services with the aim to create favorable structural conditions for person-centered care. It also aims to facilitate by initiating patient empowerment and developing a partnership between the patients and their relatives. And for healthcare professionals, that originates from the patient's resources, capacities, and needs. It also is intended to be used on a strategic level for quality assurance and improvement. It's organized in 4 main parts. First, there is a discussion or a standard about the patient's narrative and experience of illness. Then it's about the development of the partnership, then the care plan, and the patient and public involvement in the management, organization, and policy. In each part, there are 2 subcategories, one on the organizational level and one in the point of care, that is the practical level. Then there is also an appendix with case descriptions, which gives examples on how the standard can be used, but that's not actually part of the standard. It's just examples. So, as an example, the chapter about the patient's narrative and experience of illness, it starts with a general introduction, then there are requirements, and then comes the organizational level about the patient's narrative, how it should be shared, and the interprofessional teams. There is a part on the environments that shall facilitate for the patient to be prepared, and about how the personnel to be given time to allow discussion of the narrative, and also about sufficient training of personnel. On the practical care level, it's about the environment facilitating the capturing and sharing of the narrative. And then there is a discussion about the continuous opportunity to provide narrative. So, and then about the adaptation to situations, that is, alternative approaches to obtain narrative, for example, in patients who can't speak. Now, how to get hold of the standard? In Sweden, there is an access through the Swedish Institute of Standards and their website, which is shown here, and GPCC has made it possible to access reading the Swedish version for 2 years for everyone within Sweden. Or for employments within an organization connected to the Swedish Association of Local Authorities and Region, you can actually download the standard through computers connected to such an organization, for example, a hospital. On the international level, you do it through the European Committee for Standardization, the CEN. And if you Google CEN/TC450, you will come to this website. And here there is the access in English, France, or German, depending on where from you hook up to this website. And then there is, so it varies between countries, the accessibility, but it's always possible to buy it. And you buy through your national organization, and examples are here, for every country, where you can, from this website that I showed you, you just click on your national organization, and then you get hold of the standard. In most cases, on the international level, you then have to buy it, as I said. So, in summary, we wanted to create a European standard with minimal requirements for person-centered care, which we now have achieved. We wanted to support national guidelines for patient involvement, and we wanted to support the process to increase patient involvement. It should be applicable for different services in healthcare, including self-care. The work has been consensus-driven by participation of 34 countries that have voted on the standard. And there has been a consensus within the Swedish as well as the CEN technical committees about the text of the standard, which then was approved in June last year. And GPCC made it possible to access reading the Swedish version for 2 years. Thank you for your attention.